So in this short video we are going to concentrate on three main areas of the fetal anatomy. One is baby's spine, the other is looking at baby's face, particularly in respect to a baby's cleft, and the third is a pulmonary lesion called CPAM or CPAM, cystic pulmonary adenomatoid malformation. So all these come with their own particular characteristics and challenges in terms of imaging. What we have been looking at with the Samsung machines over the last 3 to 4 years is using the combination of CrystalVue and RealisticVue, particularly where we save a volume and we interrogate it afterwards. So we have taken 3 particular volumes here, and you'll see Dr. Dall'Asta showing you through how we render the volumes, how we orientate them, the settings we use to get the best volume images that we can and get the best rendered planes. And of course we're using both the 3D rendered image and the multiplanar images as well.
So this is a case of a 26-year-old para-3 lady who was referred at 27 weeks of gestation due to suspected fetal growth restriction. In this case, we are going to image a normal brain with CrystalVue rendering technology. So in first instance, we need to understand where we are in the space. We just need to, I would suggest in this case, to make it easier, I'm suggesting again to make your slice as thin as possible so that you can understand where you are in the space, and you can see now that the rendered view corresponds to the axial plane, which has to be orientated in order to be consistent between the rendering view, the rendered view, and what you want to see on your screen. However, in this case, I don't want to see the axial view, but I want to see the mid-sagittal view, so the rendering, the region of interest is not correct. I want to make it very wide and to include all my mid-sagittal view of my brain, which is now here. And now, of course, I need to rotate my volume to orientate my region of interest so that it is consistent with the mid-sagittal view. But first of all, again, I need to make my ROI very thin, and now I need to press this button, render setup button, and on the gray modality here you can see these buttons which represent the function to orientate the render view of your volume. So this is not correct. This is actually the correct one, but as you can see, this is not the correct, it is not corresponding to the actual mid-sagittal view, which is shown at the top left of the screen. So I'm suggesting to press this button to make it consistent. And now, again, let's select, we are happy with this, let's select the A-plane and let's select the two-screen modality. In this case, we can apply now the RealisticVue modality together with the CrystalVue modality, and at this point we have a nice imaging of a mid-sagittal view of a normal fetal brain, which can be seen on multiplanar view on the left-hand side, and with CrystalVue and RealisticVue on the right-hand side using thin slice. Now, of course, the volume can be navigated, and you can again use the slice button here. And if you move on one side, you can see nicely here the lateral ventricle on multiplanar view imaging, as well as with CrystalVue. You can see this is the choroid plexus here, and here using multiplanar view. And this is the hippocampal fissure here with CrystalVue. Well, if you want to see it nicely with the multiplanar imaging, you need to move further lateral, and that's your imaging with CrystalVue and RealisticVue of a normal fetal brain on mid-sagittal plane. Now, of course, you can also decide to image your volume on the coronal view, and in this case, I'm just going to rotate my volume using the Y function, and let's do it now here. And you can see a nicely reconstructed coronal view of my brain. Maybe it needs to be slightly rotated here using the Z function here. And again, I'm selecting the two-screen modality, and I'm moving anterior and posteriorly, and this is like a transfrontal view. You can see nicely here these are the anterior horns of the lateral ventricles with the multiplanar view. This is with CrystalVue. This is germinal matrix here. These are the basal ganglia. This is, of course, is the basic cranium, and that's it for the coronal imaging of a normal fetal brain using thin slice, RealisticVue, and CrystalVue rendering technologies.
When we originally used CrystalVue and RealisticVue, we were very interested in looking at babies' spines, and indeed CrystalVue and RealisticVue gives you an extremely good image of the baby's spine, either sagittally or coronally, and you can see the baby's ribs as well. So where is this useful? Well, in the context of a kyphosis or scoliosis, it's quite obvious where the angulation is, and we might see a hemivertebra, for instance. In the context of spina bifida, we can see the bony lesion and often the meningocele or myelin meningocele as well, in a way that is much clearer than using just 2D or conventional three-dimensional ultrasound.
Here we have the volume of a normal spine. This was a 24-year-old lady, and Liparus, who was referred at 31 weeks plus 6 days due to abnormal findings, suspected abnormal findings in terms of unilateral ventriculomegaly, which was not confirmed at our expert assessment. And this, I'm going to show you how to post-process a volume of the fetal spine. As you can see, the fetal spine was normal, and as you can see from this view, you can see that the volume is already orientated, so there is no need in this case to play with the X, Y, and Z buttons in order to orientate your volume. I'm just going to move to make my image more central, and as suggested, you know that at this point I always like to make my region of interest as thin as possible, and as you can see here. I'm okay with the angle of insonation. Am I? That is not the case, of course, because you can see that if you look at the bottom right and the bottom left, you can see that the orientation is not the same. So I'm going to orientate at this point the volume. I'm just pressing this 90 degrees button in order to make my coronal view fit with between the multiplanar view and the three-dimensional rendered view with RealisticVue. I'm also selecting the CrystalVue preset together with RealisticVue to make my image crisp. And at this point, I need to select the C plane, the C button, and rotate my volume using the Z button here. And now you can see that my spine is nicely oriented and beautiful to image. At this point, of course, you can play. I like playing on the coronal plane to demonstrate my anatomic structures using CrystalVue rendering technology. And in this case, I'm also selecting the two-screen modality. I'm just going back to my baby spine. I like to scroll from the back to anteriorly, just rotating with the slice button. You can see nicely here. And moving there, you can see the lateral processes of my spine here. You can see the very crisp imaging. You can see that multiplanar views gives you a nice details, of course, of the bony structures of the spine. And if you look at the CrystalVue rendering technologies together with CrystalVue, you can see that the imaging is very crisp, and this relates to the spine itself, but also to the ribs, which, as you can see here, are clearly defined. Their borders are very nicely defined here. And again, of course, you can move further anterior. You can see this is the bony part of my vertebra. These are the kidneys laterally. You can see on the multiplanar view here and with CrystalVue rendering technology here. I'm just going back with my slice button here because I'd like to show you at this point another function of the CrystalVue rendering technology. In this case, I just need to get rid of my arrow here. You can see that at the bottom of your screen there is a button which you can press here which says light direction, and when you select this button, this function, you can move the light source using your trackball, and as you can see here I can make my image crisper, brighter, or crisper just by rotating my trackball. As you can see here, you can see that by the time I move my finger on my trackball, you can see that my imaging, the quality of my imaging slightly differs, and of course it may help in enhancing contrast, which under particular circumstances may improve my imaging of the fetal spine as well as of other structures, other anatomic structures of the fetus.
When we look at a facial cleft, when you use conventional 2D ultrasound, you might see the baby's lips and you might see the baby's alveolar ridge. In truth, in 2D it's quite difficult to see the palate. But as you can see with the images that we've shown you here in respect to the fetal palate, it's perfectly possible to see not only the baby's lips and the alveolar ridge and the palate, but all the small sinuses within the baby's face as well. To see the nostrils very clearly, to see the septum of the nose, and all these things go towards giving you a full picture of what a cleft is like and the extent of it. This is particularly helpful for the parents and for counselling postnatally. This is where CrystalVue and RealisticVue in combination give you a particularly good image of the cleft because CrystalVue and RealisticVue allow you to delineate the borders between the soft tissue and the bone, and that is a particular characteristic of these rendering techniques that allow you to see the palate, the soft palate in certain instances, but certainly the alveolar ridge and the lips.
As you can see from this view, this is a very nice three-dimensional rendered view with RealisticVue technology. This was a case of cleft lip, and you will see during this demonstration that the cleft involves also the alveolar ridge and the bony palate. I always start from the multiplanar view. In order to obtain beautiful imaging, you need to obtain a good volume and orientate your volume so that you know in every moment of your offline post-processing where you are in the volume. In this case, the volume is well orientated. I just need to tilt slightly on the Z-plane on the axial view, as you can see, which is shown here on the top left here, the axial view. I'm moving the volume here with the trackball so that I can improve my rendered view, and I can make sure that my volume is properly orientated in the space, in the X, Y, and Z planes. If you want to improve your imaging of the bony structures, I strongly recommend to make your region of interest as thin as possible. I will show you that using this function, pressing this button and selecting ROI size on the screen, you can make your region of interest as thin as possible. And as you can see here, I'm making it as thin as possible here. You can see now that the rendered view is on the coronal plane. You can see the coronal planes, which is shown on the top left on multiplanar imaging, and on the top right, on the bottom left on multiplanar imaging, and on the bottom right on three-dimensional rendered view. At this point, we can select CrystalVue imaging and start playing with our volume. We also select, pressing this button, the coronal view, which in this case is here on the C plane. You just need to scroll the volume up to the front of the fetal face. You can see nicely at this level the skin defect involving the lip, as well as the deviation of the nose. This can be seen nicely here with CrystalVue rendering technology and thin slice, where you can see only minimum part of the defect here, on only the most anterior part of the nose here on multiplanar imaging. You can now see the defect, the skin defect here on multiplanar imaging. Now you can move backwards, so from the front to the back of the fetal face in order to evaluate the bony structures of the fetal face, and in this case demonstrate the defect of the bony palate. Now you move back, back again and back again. You can see the facial view, you can see the orbits here, and you move back again, selecting the ref slice button, and you move back, and at this point you can have a proper imaging of the bony structures of the secondary palate. So you are here posterior to the incisive foramen, showing what is the secondary palate, which can be seen nicely here with CrystalVue. This is the bony structure of the secondary palate. This is the tongue, and you can see the difference between the rendered view on the bottom left, on the bottom right, and the multiplanar view on the bottom left. You can see this is the tongue as it can be demonstrated on multiplanar imaging, and this is the bony structure. If we move further back, you can see here that the bony defect becomes even more clear. You can see here nicely the gap with CrystalVue. This is one end, and this is the other end of the bony structure. This is clearly the gap between the bony palate, which can be seen as a hypoechoic region, which is here on multiplanar imaging. Of course, you can't see you can't obtain with conventional multiplanar view. You can't obtain the good definition of the bony structures as the definition which you can obtain using CrystalVue rendering technology. Of course, using this approach, you can evaluate the bony defect on the coronal plane, but you can also evaluate the defect on the axial plane, and I'm going to show you why. Starting from the same coronal plane, I will just reorientate my volume. I will just move again anterior, and from here, from this view, I will play selecting the X button here. As you can see here, I'm now rotating my volume because I want to obtain a nice axial view here. You can see nicely the orbits. I'm just moving my image so that my imaging is central in the screen. Of course, if you want to have a magnification of these findings, you just need to move from the four images on the screen to the 2 images on the screen. You can see in this case both axial views. You can see nicely the orbits on the left-hand side of the screen, axial view, while on the right-hand side of the screen you can see the CrystalVue rendered view with thin slice. And at this point you can move down. Let's go down, go down, go down. And you can see appearing the deviation of the nasal septum using CrystalVue. You can see this is easier to see now here, also with multiplanar imaging. This is, of course, the nasal septum, which is deviated. But you can see with CrystalVue the crisp image demonstrating, of course, a deviation of the bony structure of the nasal septum, which, of course, represents an indirect sign of defect of the secondary palate. And at this point, of course, you can move again further down. You can see nicely here the defect of multiplanar imaging. You can see the 2 ends of the bony structures, and here anechoic is clearly seeing the defect, which is also demonstrated here using CrystalVue. In this image, you have, of course, a thin slice, and you can see also the top end of the tongue, which can be seen here. And of course, you can, if you want to image the whole tongue, you just need to move further down. I hope you can see here the tongue. This is the tongue lying between this is the alveolar ridge here. And then if you move further down, you get until the mandible, which can be nicely demonstrated using CrystalVue rendering technology and thin slice here. This is the multiplanar view, which is best visualized here, just not perfectly corresponding in the slice, but the perfect imaging, but it is for sure clearly understandable. This is the oropharynx on multiplanar view, and this is the oropharynx on CrystalVue rendering technology.
If we look at the lesions in the baby's lung, they're often very difficult to differentiate from lung tissue. So by applying 3D techniques and techniques that enhance contrast between different types of soft tissue, we can then see both the extent of the lesion and its nature much more clearly. So in the context of a CCAM, or CPAM as we now call them, we can see how far the lesion goes within the lung, how much normal lung tissue there is, because it's possible to differentiate between the lesion itself and the lung. And we can also see whether it's impinging on local structures. We can see the diaphragm as well. And being able to visualize the diaphragm underneath the CPAM is really very important, because we've all probably seen situations where lung lesions have been very difficult to differentiate between diaphragmatic hernias. So being able to get a coronal view or even a sagittal view, seeing the diaphragm, seeing the lesion above it, is extremely reassuring. And in many cases this is better, I think, in terms of resolution than an MRI scan.
So this was a case of a 34-year-old para-3 lady who was referred at 21 weeks of gestation due to abnormal findings noted at anomaly scan, and particularly due to a hyperechoic structure noted in the right hemithorax. As you can see here, this volume was acquired on the mid-sagittal view, which is now here. This volume was already orientated, and now the mid-sagittal view can be seen on the top right of the screen. You can understand that the volume was acquired on this plane, given that this is the view with the highest definition of the multiplanar imaging. We're going to image this abnormal case, which I anticipate represents a CCAM, so congenital cystic adenomatoid malformation of the lung, which was differentiated by a bronchopulmonary sequestration by the fact that there was no feeding vessel coming into this right-sided lesion of the chest. I'm going to show you again the imaging of this CCAM using CrystalVue and RealisticVue technologies, and again, in this case as well, I recommend to make your region of interest as thin as possible. So you need to get rid of your pointer, select the arrow size modality, and make your region of interest as thin as possible. And as you can see from this volume, which, as I said, has already been orientated on the coronal plane, we're going to image the lesion, the CCAM, on the coronal plane. So basically, what is herein represented at the bottom right, which is the rendered view, and at the top left of the screen. I'm just now selecting with the A button, which corresponds to the multiplanar imaging on the coronal view, and I'm going to select the two-screen modality in order to see the multiplanar imaging on the coronal plane together with the rendered view on the coronal plane using RealisticVue, CrystalVue, and thin slice. Again, using the slice button, I want to show you this abnormal case from the front to the back of this baby, and we are starting from here. You can see on the left-hand side, this is the very anterior part of the fetal tummy. This is the multiplanar view. This is the rendered view using CrystalVue rendering technology. And now I'm moving more posterior. And what can I see now? I can see now nicely here, this is the umbilical vein here with the multiplanar view, and here with CrystalVue rendering technology. And again, I'm moving further back. What can I see here at this point? Now I can see here the diaphragm. You can see the liver and the diaphragm. The diaphragm is nice, very nice and normal, both on multiplanar imaging as well as on the three-dimensional rendered view with the CrystalVue and RealisticVue technology and the thin slice. And again, I'm moving further back. I can see that the diaphragm is normal. This is very important to rule out. When you see a hyperechoic lesion of the lung, as you know, it is very important to rule out a congenital diaphragmatic hernia, which goes into differential diagnosis of CPAM as well as with bronchopulmonary sequestration. Now I'm moving further back. I can see the chest, and I can see slightly on the right-hand side of this chest, you can see nicely here, a hyperechoic lesion, which is more evident using the rendered view with CrystalVue and RealisticVue. You can see this is a lesion of the lower hemithorax, and if you move backwards, you can see that the lesion gets more evident on multiplanar imaging as well as with the CrystalVue and RealisticVue rendering technology here. How to orientate yourself, you can see nicely that this is the stomach here, and here again, this is the heart. And then, of course, you can navigate this lesion anterior and posterior to evaluate its size. It's important in this case is to evaluate the volume of the lesion, which is of paramount importance in terms of for the prognosis. Hi everyone, my name is Andrea Dall'Asta and I am Associate Professor of Gynecology and Obstetrics at the University of Parma. In this video, I have shown you how to obtain nice images, but also how to improve your diagnostic potential using two newly developed rendering technologies such as RealisticVue and CrystalVue. In this demonstration video, I hope I have shown you how CrystalVue can help you in detailing bony structures, as is the case of a normal spine or an abnormal fetal palate in the event of a cleft of the secondary palate, as you have seen in my demonstration. And I also have shown you how to image a hyperechoic lesion of the chest, such as a CPAM. You've seen how the three-dimensional render views are vivid compared to the multiplanar imaging. And finally, you've seen, in the case of normal brain, how CrystalVue together with RealisticVue can help you in detailing the brain structures, such as the corpus callosum and the cerebellar vermis on the mid-sagittal view, but also in parasagittal views, the wall of the lateral ventricles as well as the choroid plexuses. I hope this was useful for you, and thank you for your attention.
So in summary, using CrystalVue and RealisticVue to get additional anatomical detail and additional detail about the co-locations and co-adjacencies of the anatomical areas that we're concerned about, be it a lung lesion, be it a facial cleft, being it an abnormal spinal curvature or spina bifida, for instance, allows you more detail and much more context for your anatomical surveys. One important thing that we don't often talk about is that for us as fetal medicine experts, we can often get the information we want to from a 2D image or a simple 3D image. But showing it in beautiful color with very clear edges is extremely important in patient counseling. So we can not only make a diagnosis with a significant degree of certainty, but also show patients what we can see. Particularly useful in the context, for instance, of facial cleft, where mums and dads are often very concerned about where the cleft is and what sort of surgery the baby will require after delivery.